Hello everyone, you're welcome to today's class. My name is Dr. Henry Isagboyin, and we are continuing from the series lecture that we've been having for a while. Today we'll be taking the part 2. We have seen the part 1, continuing discussion on health program planning and evaluation. Health program planning and evaluation. I'm sure you've watched the part 1. If you haven't, please take time out to watch the part 1, which was on program implementation and management function. And under it, we looked at the principles of health program management, organizing, staffing, directing, and controlling. We also looked at leadership in program delivery, and we looked at some examples. Very importantly, we took some discussion, checked out some questions, and you had there were few assignments. Today we'll be continuing at the part 2, continuing the discussion on health program planning and evaluation, part 2. And on that part 2, we'll be looking at the topic support systems for health program implementation. Support systems for health program implementation. Once again, my name is Dr. Henry Isagboyin, and you are welcome to class. These are the topics that we'll be looking at under this discussion. We'll be looking at what support systems for health program implementation truly means, what are the logistics, the communication, supervision involved. We'll be looking at health information systems and record keeping. We'll be looking at practical demonstration of data recording and also reporting. And so, I welcome everyone back in today's lecture. Today we'll be examining the hidden machinery that determines whether a health program will succeed or will fail. And that is the support systems. Now, these systems include logistics, communication, supportive supervision, health information systems, and record keeping. And they form the silent backbone behind effective service delivery. Now, a program may be scientifically sound, may be built on strong epidemiology, backed by global evidence and supported by national policies. Yet, in practice, it can still collapse if the support systems are weak. For example, vaccines may expire because cold chain systems failed. We also have malaria medicines may be unavailable because procurement was delayed. And also we could find that outbreaks may spread because surveillance, information was not reported on time. HIV clients may default because the registers were incomplete. And so they didn't have access to data, or the data wasn't correct. You could also have maternal deaths increase. Why? Because communication failed between the facility and the referral centers. According to the Oxford Textbook of Global Public Health in Chapter 11, it reminds us that effective implementation is not just about having a good intervention, having a good plan, or putting together a fantastic idea, but it is about sustaining the systems that will carry that intervention across the facilities, the local government areas, the states, and communities. So in countries like ours in Nigeria, these support systems determine whether a program reaches people or remains on paper. So you cannot afford to joke with the support system, because it goes a long way to determine if that program will reach the people, in other words, will achieve its goal, or will remain on paper but pretend to reach to the people, and the outcome of that is already a failure. So let's look at a few definitions. The first one is the support system. The support system are the structures, processes, tools, and mechanisms that enable the smooth delivery of health programs, and they include the entire operational infrastructure. They also include logistics. They also include communication channels, data systems, supervision mechanisms, and documentation processes. In fact, they make implementation possible. So you can't afford to joke with it. Without the support system, even a well-designed program will fail at the service delivery level, at the facility level. Let's look at the next definition. What is logistics management? Logistics management refers to the planning, the procurement, storage, the transporting or distribution, as well as the monitoring of all commodities required for health programs. Again, logistics management refers to the planning, procurement, storage, transport, distribution, and monitoring of all commodities required for health programs. Now, these commodities include vaccines, HIV test kits, anti-malaria medicines, tuberculosis medicines, nutritional supplements, personal protective equipment, laboratory reagents, service registers, reporting tools, cold chain equipment, just to mention a few. All these things are needed at the clinic. And it is very, very important that you have all these commodities available so that you'll be able to succeed, or the project would be able to proceed or make progress without any challenge. Put it this way, the goal is to ensure that the right commodities reach the right place in the right quantity at the right time and in the usable condition. This is key. This is very important, and we must ensure that when we bring in these commodities are good enough to be able to do what? Distribute and be usable when they are distributed. So that's that about logistics management. Let's look at the next definition: health information system. A health information system is the coordinated mechanisms to analyze, interpret, transmit, and report health data to support decision making across all levels of the health sector. A functional health information system will help the managers detect outbreaks very early. It will help them track immunization coverage and will monitor disease trends and decide where resources should be directed. This is very, very important. Now, with a good health information system, it will allow whoever is in charge to be able to ensure that there is proper accountability. And for Nigeria, we have Nigeria's primary health care. And this is functional and has helped in guiding the policies, has helped in ensuring that there's resource allocation and that there's good outbreak response, there's good staffing, program evaluation easily can be carried out. So these are part of the functions of the health. The health information system helps us provide all the data that are needed for evidence-based decision to be taken. Because if you take decisions on the field without being backed up by evidence, you would be surprised that you would be taking decisions that are not based on the accurate happenings. So it could lead to a wrong outcome. And that's why the evidence-based treatment, the evidence-based decision, or the evidence-based, policies thrive better. So when these functions are going on, data are collected with the HIS, the Health Information System, gathering the data, you can easily tell what is the trend, what is the happening, what is the incident rate, and that way you can plan for any, eventuality, and you can take decisions based on the true reflection on the field. We look at the next definition, record keeping. Record keeping. It refers to the systematic documentation of all program activities. Take note, documentation of all program activities. And this simply means that at every point in time on the field, a day can't pass without ensuring that the documentation of every happening, every outcome, every decision that was taken, including the services that were delivered, the commodities that were used, all the clients that were reached, how many, male or female, what cases was found, and the outcomes that were achieved. Because this documentation will help maintain continuity of care, and it will ensure accountability and supports accurate data reporting. We look at the next definition, which is supervision. This is the supportive supervision that we're talking about. Supportive supervision for the health workers, supportive supervision for way of improving performance. So supportive supervision refers to the structured, regular, mentorship-based oversight that aims to improve the performance of health workers, and it focuses on guiding the staff, solving problems, improving knowledge, correcting errors while they are observed, ensuring the quality of care is maintained, reviewing the recordability as to how funds, as to how assignments and other things are delivered. And so supportive supervision is different from punitive inspection. You are not doing it because you intend to be very hard or you intend to, suffocate the workers, but you are doing it because you intend to encourage the workers. You are doing it because you intend to monitor them, mentor them, and help them improve in their performance. So it is a collaborative act. You and the workers together learning, together putting us, together to ensure that the job is done and done successfully. And so it's a collaborative effort and capacity building intention. So while we do the job, we grow on the job and we learn on the job. And you can only conduct this supportive supervision through visits. You visit them on the site at the place where the job is done. You review what is being done. Not only reviewing, you check from time to time how they are done. Are they following the rules? And so on. And then coaching. And then coaching. So that's all about the definition. We'll be moving next to the key concepts. We'll be moving next to the key concepts. Now, let us move to the key concepts. The key concepts are very important when it comes to support system. The key concept simply illustrates the foundation. Now, when you say components, when you say support system, the support system is built on some certain pillars. some certain foundations that keeps any project sustainable, continuously running. And so these key concepts, you must take note of them. It is applicable on a daily basis for any project, any implementation of any plan. So what are these key concepts? We will refer to them as components of the support system, and we'll look at them one by one. The components of support systems, as you can see, they include, number one, logistics and supply chain management. Number two, communication systems. Number three, supportive supervision. Number four, health information system. Number five, record keeping mechanisms. Now, we will take them one by one. Let's begin with logistics and supply chain management. This covers the full commodity life cycle, where we talk about procurement and forecasting. That is, you make payments, you buy the things needed by the clinic, by the project, by the hospital, or that section of the NGO, or that organization, all that is required, the resources. You make arrangement to buy them, and you do some forecasting. How many will we be needing in the next 6 months, in the next 1 year? And that is only possible because you have a good recording of how many you have used in the last 6 months. So if we have a proper recording of usage in the last 4 months, we can forecast what we'll be using in the next 6 months by doing some basic mathematical analysis. Secondly, we have the cold chain maintenance. We need to store the vaccines properly in a good storage at a good temperature, 4 degrees centigrade, and some of them at freezing temperature. We need a good cold chain maintenance. So you need an inverter, you need a good fridge or inverter fridge. All these things have to be in place because you can't rely on the grid. It could disappoint you. You also need a warehousing and distribution. When you are dealing with a state, we're talking of thousands of supplies here, all the local government in the state. You need to put the whole thing in a warehouse. A warehouse will be big enough to contain everything. And from there, you'll be distributing to each local government. And in each local government, remember, you'll be distributing to each ward. And so you need a good warehousing where you will stock, and from there you will distribute. You also need fleet management. It covers fleet management, the arrangement for the transport, shipping, either by sea, transporting by air or by road. You have the inventory control, where you have to control what goes out and what comes in, ensuring that whoever is delivering must give account, must report, I have delivered, it was received in good shape, and there's evidence that they signed or they received it. The next one is stock monitoring, where you use the bin cards registers. That's those cards that, you know, they have to sign on, they have to tick on, evidence showing that it was distributed, evidence showing that it was accepted. You also need the registers where they write, for example, in the clinics and so on. So these are the commodity life cycle. I've mentioned them. You can see them on the screen that make up the logistics and supply chain management. Why is it important? Poor logistics will lead to stock out. So you have reagents, you know, exhausted before the date of purchase because the proper logistics was not put in place, the proper procurement and forecasting was not done. You also have, when we overstock, you have samples, reagents, resources expiring because we didn't completely use them. And that is very important. So it leads to wastage. You have expired vaccines. You have low service coverage. And because of that, maybe the people weren't properly discussed with. You didn't go to see the community heads, and proper mobilization or proper campaign wasn't done. The people are not aware that certain program will be taking place in the community. And so they didn't turn up, or the distribution wasn't effectively done. And so the coverage wasn't really reached. The next one is the types of communication system. Remember, we are dealing now on the components, the foundation. We have seen the logistics. Now we are looking at the types of communication system. Now, if we are going to look at this topic, then you must have at the back of your mind that communication is the central nervous system of implementation. Communication is a central nervous system of implementation. And there are different types of communication. You have the upward communication, where you have the flow of information from facilities to the local government. Look at that hierarchy, to the state and to the national level. An example is the immunization coverage reports or the stock reports or disease notification. Now, this information is coming from the facility, the health policy, the primary health centers, the local health centers, and then the report goes to the local government area, and then they package that report and send it to the state ministry, and from there to the national level. And that's the upward, which is known as also the vertical communication. You have the downward communication as well. This is where policies and guidelines and standard operating procedures, circulars flow from the national to the state and to the local government areas and to the facilities. So this is now the government communicating down this time. Unlike the upward communication, you now have the downward communication, where policies have been approved and these policies are set down for the LGA's facilities to implement. Now you have the horizontal communication. This has to do with collaboration across units. This is horizontal, from left to the right, amongst units, people at the same level. For example, the surveillance officers and the laboratory personnel communicating what they have observed. Another example, the facility staff communicating with the community health volunteers. Another example, you have the local government area health educators going to schools, and also the town criers moving from community to community to, educate the people. So that's a communication between the LGA educators and the school students, the school teachers, the town criers, and the community. Communication tools in Nigeria. What communication tools do we currently use that is very common in this country? You have WhatsApp groups. If you notice, a lot of communities, a lot of groups, a lot of organizations use the WhatsApp in order to be able to communicate surveillance alerts. You have the District Health Information System dashboard. That's another communication tool. The District Health Information System dashboard. Take note, that's another tool. You also have the radio announcements. That's another tool for announcing information, just like it was done during the COVID-19, where informations were disseminated from time to time. Sensitization was made from time to time, and everybody was listening to the radio, watching the TV, the Ministry of Health, and so on. So nothing was hidden. And when every person gets information related to them, they go and implement it. So that's about the radio announcements, media, using the media, and so on. You also have the facility notice boards. The facility notice boards, where you have a notice board in the facility, information is pinned there, and everybody goes to see and take note about it. Now, the Nigerian Center for Disease Control also has its own situation report that is published from time to time. You have the Integrated Disease Surveillance and Response weekly bulletin that is distributed from time to time. So you can see these whole tools: WhatsApp, the DHIS dashboard, the radio, other media like TV, internet, facility notice boards, the NCDC situation report, the IDSR, that's the Integrated Disease Surveillance and Response weekly bulletin. For example, during the Lassa fever outbreak, we had this happening. There were emergencies. daily reports from the Nigerian Center for Disease Control, which enabled rapid updates, which enabled risk information communication, and this prompted response across all the AGAs. What they needed to do, they did in order to protect their staff and their selves. So that's about our communication system. But there are feedback loops. When you communicate, you want to get response back. And so you get that from feedback loops such as the monthly reports, supervision visits, the WhatsApp platform. So when you communicate to the higher level, you are patiently waiting for their feedback. And so that feedback comes from time to time. It may not be immediately, but definitely it might come via monthly reports, it might come via supervision visits, it can come via WhatsApp platforms. But the point is that when communication is made, there will always be a feedback. Now the next one is supportive supervision. Supportive supervision enhances the quality of care by improving health worker performance. And this includes on-site monitoring. On-site monitoring by way of mentoring them. You support them, you supervise them, and you mentor them so that they do the right thing. Observation of service delivery. Register, review, you check the register, be sure that they are doing the right thing. Correction of documentation errors. When you find errors, you correct it immediately, because if you don't, they will continue in that error and it will affect the entire register. How about supply gap identification? Those are part of the key activities. Are there any gap in the supply? Is there anything they've been waiting for, but they couldn't use because it was not supplied? Team feedback meetings. You call for meetings from time to time, and then on the job demonstrations, there's a particular part that needs to be shown as a practical example for everybody to see. So those demonstrations can be done, everybody comes together and see the way it is done. There could also be development of action plans. You get to a point, there's a need to develop an action plan. So let's see one Nigerian example. We will take the polio eradication initiative as an example. I will say that this polio eradication relied heavily on supervision structures, where the LGA supervisors had to check the vaccinators, they had to check the performance, they had to verify all the micro plans, they had to review the map areas, they had to inspect the code boxes if those vaccines were properly stored. And they had to ensure that children were not missed out between the particular ages that were supposed to be attended to. What is the lesson here? The lesson is that supervision maintains quality. When supervision takes place, quality will be sustained. It will correct problems very early enough, and it will strengthen staff motivation. That is key, and on no account can you joke with that, because when supervision is out of place, the staff becomes weakened, they get tired, and no motivation is taking place. So you can't afford to leave out supervision. We move to the next one, health information system. Remember, we're talking about the foundation. We're talking about the pillar, the key components. So, what are the components of health information system? Health information system is the intelligent unit of a health program. The intelligent unit because it provides all the data that we will be using for decision making. And so it makes decision making based on evidence. Therefore, without data, decision making becomes a guesswork. Of course, without being told, you know the danger of guesswork. So what are the core components of the health information system? Number one, data collection tools, where you have the tally sheets, billing registers, the antenatal care cards, HIV care cards, tuberculosis treatment cards, and so on. Remember that when you want to see the doctor in the hospital, you will need to go and get your file. That file is what goes ahead of you to the consultant's room, where you will be consulted. Where you have to see the physician, and then consultation will take place. And on that same file, where you have your old records, a new sheet will be brought in, and that's where every information will be minuted. So that at a glance, a new medical officer, a new physician can go through your data without missing out any detailed information. So data collection tools are very important, and they are simply your routine service registers. Number two, data transmission. Data transmission. An example is the district health information system. Now, this health information system is where data is managed, and it moves from facilities to the main point where it is needed. So all the data gathered in the clinics, gathered at the field work, gathered in the communities, is transferred from that facility to the district health information system. You have it on your phone, you have it on your laptop, you have it on your pad. It's like an app. You open it, you enter the detail, how many female, how many male, how many children, how many vaccines were given, which locality was the vaccines given, at what time was those vaccines given, what was the temperature of those vaccines, what were the findings, what were the outcomes. You send those information without delay. It must be done in less than 5 hours from the end of the day's function. So the district health information system is key. It is used nationally for routine reporting. Just as you have it, when you send information in a locality, in a village, in a district, that information gets to the national center at once. All you need is an internet. Once you put on the internet, you put in the information, it moves straight to the national office. Number three is data validation. Data validation. The LGA and state monitor evaluation officers will verify that the registers are completed, will verify that the tallies from the store, from the logistics arm, or the procurement, or what was taken are well accounted for, that all the tallies are properly done, they are accurate. They will also check for correctness of the monthly summaries. Every month, the officer, the supervisor is submitting the summary. They have to check if those reports are properly done and those summaries are okay. They also want to check the consistency between stock and service data. The consistency between the stock and the service data. So that's that about data validation, ensuring that the data is okay. Next is data review and feedback. Managers, they use this dashboard and the monthly review meetings to identify where there are gaps, because they have to study all this data. The data will reveal a message. These data will reveal gaps. These data will reveal challenges that may not have been seen. It may be hidden. It may not be obvious. So it will identify those gaps. It will plan the outreach sessions, and such that this information in the meetings will help to plan properly the session going forward. It also helps to understand if there's a need to redistribute the commodities, so that if it is observed that the way the distribution was done before wasn't right, then they correct it. And finally, the data review and feedback will help to investigate when there's a performance decline. Why is there a decline? Where is the decline taking place? How and what is responsible for it? And that way, the needful will be done. The next one is record keeping tools, which is the last. Remember, we have been discussing on the key concepts, and we began by saying components of support system. Number two, we looked at, under the components of support system, we looked at logistics and supply chain management, communication system, supportive supervision, health information system, record keeping mechanisms. These are the key components that makes any support system survive, sustainable and useful, so it can be applied. Now we look at the theoretical framework. Theoretical framework. We will start with the WHO Health System Framework. When we say framework, framework is another key stronghold that keeps the support system, aligned with the building blocks that is internationally recognized, the building blocks that is meant to be intact so that it will be applicable, repeatable anywhere apart from your locality. So the WHO Health System Framework ensures that support system align with building blocks. Here you have the information system. Here we have the medical products and logistics. And here we have the leadership and governance. At that level, the WHO Health System Framework will provide information system, which you will have in your, devices. So no matter where you go to, you can communicate with the WHO office or the headquarter office. So that framework is intact. Number two, what you need, the logistics and the medical products from the headquarter will be supplied. That framework will ensure that. And number three, there need to be leadership. Somebody needs to oversee, and everybody needs to answer or report to that office. So in terms of governance, where you have supervision and communication, ensues. So that's that about the WHO Health Systems Framework. If you look at a case scenario, let's look at it so that you understand what we mean by this framework. Now, a primary health center in Kaduna State reports that there is low immunization coverage for 3 consecutive months. Now, when the supervisor was sent there to go and check, they discovered that number one, there were errors that were being done on the field. The tally sheets were incomplete. The stock records were missing. Vaccine finished, and this was happening regularly. And then they saw that the district health information system reports were delayed. Instead of them to enter their reports every day, they were delaying it beyond the normal time. And so this resulted to low immunization coverage for 3 months until the supervisor was sent from the headquarters office to come and find out what has happened. Now, of all this, what part of the support system failed? When you look at all this problem here, the question is, which support systems actually failed? Number one, record keeping. If you look at record keeping, you will know that the record keeping failed because we see a case of incomplete tallies. They didn't fill it. Some people will come and take drugs, they will not fill it, they won't tick it, they won't state that they've taken in. And so, stocks kept on finishing even before the time because records were not showing that they were being taken. They were not accounted for. Number two, the issue of stock records getting missing. That's the failure of logistics. When you talk about support system, you see now we're applying the support systems now. Logistics failed. That's why there is stock out. Now, you can see that they delayed their reports in the district health information system. So what part of the support system failed there? It is the health information system. They delayed their reports. The fourth one, communication, because there was poor feedback and reporting flow. If they were entering the DHIS properly, information would have come because analysis would have taken place that something is not right somewhere. And so we also see that support supervision is another part where there was system failure, because these errors persisted without correction from the first month to the second month and into the third month. And this was not acceptable because it has led to the failure, waste of fund and manpower in the last 3 months. We continue. How did this weakness affect the coverage? How? The incomplete tally sheets, it affected that coverage because underreporting and poor micro planning took place. Remember, when you make your report every day, it will provide evidence for micro planning because there must be a meeting every morning before we go into the field. So yesterday's data will serve as the decision-making data for serve as the evidence for the decision-making for today. But because data were not being submitted at the right time, they go out again to the field ignorant, doing the same thing they did yesterday, and then they get a poor outcome. Number two, the missing stock records. How did the missing stock records affect or bring about weakness? You have the inability to forecast needs. Because when there is no stock record, how do you know that the reagents will soon finish? How do you know that the drugs will soon finish? How do you know that you are running out of equipment? You don't know. Because the record, the cards don't show that these things have gone out. And so you find inability to forecast properly. Stockouts, now it has happened. They come for gloves, it's no longer there. They've come to ask for nose mask, it's no longer available. And because of this, there are missed immunization days. Because we don't have the vaccine to give to them. Because it is finished without knowing. We just discovered that they took 22 yesterday. And it was not written. So we were thinking the 22 was still in the stock. But only for us to realize that there were no vaccines. And when we checked the card, they didn't write it down. And we look at the card shows that there is still remaining 22. You see the problem? And now people call for immunization, but there is no vaccine to immunize them, the babies. So there are missing immunization days. And the delayed DHIS, you see this low response from LG and the state teams because they did not get the information. If the information was sent earlier, these things would have been mobilized. And so the failure, the weakness of this whole process has affected the coverage. Having seen the problem, what are the corrective actions that we need to take? We need to retrain the staff. Obviously, the staff appears not to know what to do. They don't understand the importance of documentation. So we need to retrain them. We need to really retrain them. And then we need to strengthen the supervision. We need to implement regular stock audits so that we know when things are getting exhausted. And so that they can be stocking and not excessively, stock the storeroom. You also want to ensure consistent data validation. Somebody needs to check those data from time to time if it is correct. And they need to establish a reliable communication channel like the use of the WhatsApp so that everybody knows what is going on and what needs to be done. So I'm sure you have seen this very detailed case scenario and you have learned something from there. Let's look at another framework called the Donabedian framework. The Donabedian framework. Now, this framework, very simple. It deals with the structure. It has logistics. It deals with logistics. It ensures that there is staffing. It ensures that the facilities are intact. It ensures that the health information system is utilized. Now, what is the process? Number one, communication. Number 2, supervision. Number 3, record keeping. It ensures that things are done properly by communicating. Supervision is intact and record documentation is done. And what is the expected outcome? That there will be improved coverage, there will be reduced mortality, and there will be improved quality care. So you see that with this framework, support systems form the structure and the process to creating the outcomes. Take out the support system, no project will have a successful outcome. It will only lead to waste of resources and manpower. Now, let's look at implementation science model. But before then, this is where we move into the models that are used in support system. The models that are used in support system. That's the next aspect we are treating. Now, implementation success will depend on the following. And please take note of that. Number 1, the environment where the project is being implemented. Number 2, logistics. Ensure that the logistics are available. Number 3, human resources. Ensure that the human resources are available. Number 4, communication. Ensure that the communication is intact and that the data system is available. Once you have these tools available, these areas intact, then you see that the model will work. Now, strong interventions will fail even in a weak system. With this on ground, that system is ready, good, and okay to thrive with any project that comes. So let's look at the next model, logistics cycle model. Now, this has to do with some steps where you have the selection, procurement, storage, distribution, use and service delivery, reporting, feedback, and supervision. So logistics is continuous, not linear. It's a continuous aspect of any project. You keep supplying, ensuring that things are intact. Every step feedbacks into planning. So every step you take with the data reported, it comes back into the planning table. So when we say procurement as a key component of logistics, this includes forecasting, quantifying, and purchasing commodities. And also, we must know that weak procurement will lead to shortages, overstocking, wastage, or expired products. Number 2, storage. Vaccines require cold chain storage systems from the national level to the state cold stores, the LGA cold stores, and the facility refrigerators. Storage must follow the correct temperature ranges, stock rotation rules, that is first expiry, first out. When you have the reagents or the vaccines, you distribute those ones that will expire first. Those ones are the ones that will go out first. Those ones that will expire later, we hold on so that we distribute them before they expire. So first expiry, first out. We call it the FAFO. So you let those ones that will expire first to be distributed first. Also, in terms of storage, there must be proper organization of the shelves so that we don't begin to look for things everywhere. The shelf must be properly arranged so that we can tell where gloves are, nose masks are, drugs are, thermometer, and all that things. Now we also see the transport and distribution. The transport and distribution. In the transport and distribution, this includes the cold boxes, vaccine carriers, motorcycles for outreach, the trucks for bulk supplies, the boats in the river areas, bicycles for hard-to-reach settlements. Transport must protect commodities from heat. The transport must protect those commodities from damage or contamination. So it must be transported in the right format, protecting it from damage. The next one is inventory control. Inventory control. Here, the head facilities, as you can see, use several tools to be able to track the inventory. They use the stock register. Whenever things are distributed, it must be written that you received so and so. It must be written that so and so was given out. The bin cards that's used to the stock control cards. For every tool, for example, gloves have a bin card. Nose mask have bin cards. So if you take 2 nose masks, in the bin card of nose mask, you must write 2 taken and signed. If you take 10 for gloves, you must write there 10 packs of gloves taken inside the bin, separate bin cards for gloves. So every commodity has its own stock card. You have the issue vouchers. When things are purchased, you issue the voucher to show evidence. You have the requisition forms. When things are received, you have the monthly stock summary sheets. So all these documents must be in place. So inventory control will prevent stockouts, and it will ensure that there's accountability. When it is time to account for what you were given in millions, the things that were bought, you were able to account for them, how it was used, the date it was used, and when was the last usage. And then you have the reverse logistic. This involves retrieving expired or damaged commodities and returning them to central stores for proper disposal. So maybe things got damaged, there's a need to, return them back. So I believe that you have taken note of these few aspects, the key component of logistics. I've talked about them. Apart from all of this, they are inside, but I just did a further explanation. Procurement is one of them. Storage is one of them. Transport and distribution is one of them. You can add inventory control and also reverse logistics as well. So this is the cycle model. You may be asked to draw it in an exam. Very simple. Selection. What do you want? What do we supply? What do we procure? What are we going to ask the vendors to supply? We make the selection, then we supply them. That's the procurement. We receive them, and then we distribute them to the departments that need them, and then we keep record of how they are used and the service with which they are used to supply, and then there's a proper reporting at the end of the day. Now, this is logistics. We're looking at Nigerian examples. For example, the ACT stockout, that's the anti-malaria therapy drugs, stockout during malaria season due to weak forecasting. That's a challenge. In COVID-19, vaccines required cold chain expansion. That's logistics. They need to buy the fridge, the freezer, maybe solar panel enabled, cold chain storage apartments, so that they can be able to put those vaccines intact and not rely on, the usual grid like NEPA and so on. Now, we also have the NPHCDA, which talks about the primary health center development agencies. They deployed ultra cold freezers to be able to take care of this challenge. You have the UNICEF also supplying solar refrigerators, which improved rural vaccine access. So the lesson here is that weak logistics will only bring about weak outcomes. So if you strengthen the logistics, there will be improved outcome. So this is very, very important. Now, we also look at the communication systems. As an example, during the Lassa fever outbreak, you see that NCD was sending daily situational updates. Information flows from local governments, and information was flowing from the top. When we watch the TV, we hear the radio, information were coming to the LGAs, and from the LGAs, they were sending information to the facilities. Now, the way communication, if it happens, it will cause delays. It will cause misinformation, because the people will be confused, getting information from the wrong place, and also weak communications will cause avoidable deaths, because people who want to be taken care of were not taken care of. So it's important that we have this in mind. So that's the impact of the communication system and what happens when it is weak. The supportive supervision. Here, an example is the polling campaign. The supervisors were, how to verify the micro plans. Every day, meetings were taking place every morning or perhaps every evening. And it was based on the data that were gathered. We have also that they checked code boxes. They checked the code boxes to ensure that the temperature of those vaccines were intact. And then they corrected the errors immediately where the errors had been observed. And the lesson here is that supervision prevents implementation drift. When there is proper supervision, it will prevent the workers from going the wrong way and everything would be in place. So it is very important that we take notes about that. The next one is the health information system platforms in Nigeria. The health information system platforms in Nigeria. Well, we've talked about them. Number one, we have the district health information system. We have the integrated disease surveillance and response forms. The SURMAS simply means the surveillance, outbreak response management and analysis system. Surveillance, outbreak response management and analysis system. You have the LMIS that is used, for example, in the laboratory, logistics management information system. You have the routine service registers, which include that of the immunization, ANC, that's antenatal care, HIV, and the tuberculosis. All these registers are clear information system platforms that are used in Nigeria. They have their challenges. What are their challenges? People don't register, do their registration completely. So you have incomplete registers where there are no age. Instead of them to write female or male, you see that sometimes it's missing. So this person, is he a female? Is he a male? Sometimes some of them don't write for the ANC, how many children have they had? You don't see those informations. And you also see cases of delay reporting. They don't report as at when they ought to report. We also see cases of poor feedback. Feedbacks are not coming as at when due. We also have the problem of data entry errors. What was supposed to be entered for line 5 is entered for line 2. In case of the manual entry, and sometimes on the computer, you see them entering the data for another person, confusing it for another person. So because you are transcribing from your paper to the system, so the information for patient 6, you are writing it for patient 5 because of error due to parallax of the eyes. So that's another major problem. And then you have weak supervision. Weak supervision. But what's the lesson here? The lesson is that high quality data leads to high quality decision. If we provide the quality data, I can assure you there will be quality decision. Finally, in this aspect, we're looking at the record keeping importance. You see here that accurate records will help to track patients. If there's a need to call back a patient, we can see the address, the phone number is there. But when the address is missing or the address is incomplete or the phone number is not correct, instead of 11 digits, you have 10 digits, there's no way we'll be able to get that patient. And that could lead to deaths that can be, prevented. We also have the support audits, accurate records. We're talking about support audits here. Guide resource allocation, because accurate records will support the auditors to be able to take good decision if we are doing well or not. Accurate records will help to guide resource allocation. Accurate records will help to provide donor evidence. It will also strengthen accountability. But when there is weak records, there will be poor data and there will be poor decisions. When there are weak records, there will be poor data and there will be poor decisions. Now let's look at some practical demonstrations before we round up. Some practical demonstrations before we round up, so that you have a practical feeling of what we are talking about. Now we start with the ANC register example. What happened? Register tracked the pregnant women, because when they came to the clinic, all these things were written down about them and included the date, the name, the parity, the gestational age, and the dose that they have been taking. And what were the lessons there? It was observed that structured registers ensure standardized data. If the register is well structured, you will have all the data supplied, and it will provide continuity of care. In case the patient needs to be called from home for certain treatment, the patient will be called if they observe anything from the results while the patient is away. You also have accurate reporting. That's a big lesson from the use of the antenatal care register. Let's look at the demonstration here. This is an ANC register as an example. You can see dates, the name of the client, gravida, and that's to say how many children, gestational age, the dosage. So you can see the dates. You can see the name Amina Tunde. You can see G3, G1, talking about the number of children. 24 weeks pregnant, 12 weeks pregnant, have taken the dosage, has not taken any dosage. So you can see that these are the informations. And what's the lesson there? A standardized register will reduce error, it will support continuity, and it will improve the reporting accuracy. Let's look at the next example, store control card. What happened? The ACT is recorded as issued, because as you issue out products, you issue out commodities, you issue out anything from the store, you ensure that you record them down. So all those drugs were recorded as they were issued. That's what happened using the stock control card. We also see that there is the case of balanced tracked. The balances were tracked. So we can tell that we gave out 16. And out of 20, we have 4 remaining. Now the card can correlate with what we have physically. So if the card says 4 is remaining as the balance, we look into the store, we see that it is also 4 that is remaining. Now, what are the lessons? The store cards prevent stockouts when they are properly used. It also enables inventory reconciliation. We want to find out what is inside and what we have on the record. It's easy to reconcile and know what is exactly happening. So this is an example of a stock card for a drug given to this patient, maybe for malaria treatment. The opening balance was 200 doses. Now look at the dates. On the 5th of February, 40 was issued. What's the balance? 160. And then the officer that took it signed. Now on the 8th of February, another 20 was taken. Out of 160, you now have 140 remaining. The officer that took it or issued it has signed. What's the lesson here? Good stock documentation will prevent stockout. It will prevent wastage and it will prevent fraud. And so if there is any shortages, we can identify. So with this card right now, it tells me that there are 140 of these drugs remaining inside the store. Remember, it was initially 200, but the record. Now, just seeing the record, we can now go into the store to reconcile if truly 140 is remaining. Now, let us see further case scenarios. Now, practical in the communities. Now, we take the first, case study scenario in a primary health center in Kaduna with low immunization coverage. A primary health center in Kaduna had a low immunization coverage, and this was due to incomplete tally sheets, missing stock records, delayed entering in the DHIS reporting, and vaccine stock out. Now, that field support system happened as a result of what? Field logistics, field health information system, field record keeping, field communication, and supervision. The lesson is that funding cannot fix weak support systems. Success depends on daily discipline and documentation. This is very, very important. I'm sure that you've learned a lot. Now, to check what we have learned, let's take a few discussion questions. Now, let's look at a few questions and then we know our assignments. Question number 1. Why are support systems described as infrastructure behind infrastructure? Number 2, how does weak logistics affect immunization coverage? How does weak logistics affect immunization coverage? Why is communication critical during outbreaks? How does poor recording keeping lead to poor decision? How does supervision improve service quality? Which system failure is most damaging at PHC level and why? So you are expected to answer these questions and then submit at the comment below this video, lecture video. You do not need to put your name. You have to put your matric number. Like you all know, after that class session, which you are supposed to take time to watch this video, I will go to the YouTube page and I will take note of the assignments after the deadline. So I will read through and the mark numbers will be registered, and that will be the entry of those who have taken part in this study, in this discussion. So make sure that you do that. Now let us see these MCQ questions. Of course, there will be MCQ during your exams. Which system converts raw data into information for decision making? Logistics, health information system, supervision, record keeping. Remember I told you, the system that converts raw data into information for decision making is the health information system. Now, stock control cards are primarily used to record patient diagnosis, track commodity balances, supervise staff, report outbreaks. The answer there is to track commodity balances. That's why we use the stock control records, so that the commodities in the store, we can check how many is remaining. Number 3, Nigeria's primary health information system platform is what? I told you that it is the District Health Information System 2. That's the improved version of the initial health information system. Number 4, supportive supervision focuses mainly on what? Policing staff, mentoring and quality improvement, punishment, data entry? No. The answer is mentoring and quality improvement. That's the reason why we supervise. Not for punitive measure, not to police the staff, not to punish the staff, but to mentor them and ensure that there's quality improvements. Which failure most directly causes vaccine stockouts? Which failure mostly causes, vaccine stockouts? That's very important. Is it poor communication? Is it weak logistics, poor supervision, weak leadership? Which one of these can cause vaccine stockouts? You already know it is weak logistics. It is logistics that guarantees, good logistics that guarantees that the commodities are available, supplied at the right time, and make sure that it doesn't get, exhausted before supplies are made. Now let's look at these questions and I will answer these questions. So relax and listen because they are important. Number 1, define support system in public health. If you have to define it from what we have learned, you simply state that support systems are the invisible infrastructure behind the infrastructure of public health programs. They are the structures that are put in place, the processes and the operational tools that enable the health workers to deliver services effectively. They include logistics, communication pathways, supervision systems, health information systems, and record-keeping mechanisms. Now, without strong support systems, even a well-designed health program will fail at the point of service delivery. Number 2, list 2 functions of a health information system. 2 functions of a health information system. Number 1, early detection of outbreaks through surveillance and routine reporting. Number 2, tracking program performance, such as immunization coverage, HIV virus suppression, because as the patient takes the drug, the CD4 count will do what? Will increase, the viral load will come down, and so it goes to do the CD4 count analysis. Other functions mentioned include guiding policy decisions, identifying stockouts, and also ensuring accountability. Number 3, state 2 consequences of poor logistics. The consequences of poor logistics management. They are, number 1, you will find out the case of stockouts of essential health commodities. Vaccines get stocked out, drugs get stocked out, test kits get stocked out. Number 2, you will find that there will be wastage and expiration of supplies. There will be wastage, supplies will expire. And this will lead to low service coverage because there's nothing to take to those localities. So we see that in our lecture note when I was discussing, I emphasized that poor logistic results in expired vaccines. It results to wastage and weak program outcomes. Number 4 question, explain supervision with a Nigerian example, with one Nigerian example. All right. Now, supportive supervision is a structured oversight process focused on mentoring, guiding, troubleshooting, and improving service quality, rather than policing the staff or punitive measures or trying to oppress them. It involves activities such as on-site mentoring, checking their performance review, correcting when there's documentation errors, identifying when there's a supply gap, and also carrying out facility audit. That's the essence of supervision. An example is during polio eradication campaign in Nigeria, the supervisors visited the households and the facilities to verify what the micro plans are. That is, what were your decisions on a day-to-day basis as to what to do on the field. It checked the code boxes for the temperature of the vaccines, also observed the vaccinators if they were giving the vaccines properly, and also to correct errors where they are found. He corrected them. Question number 5. Why is recording keeping essential for accountability? Why is record keeping essential for accountability? Record keeping is essential for accountability because it provides the accurate documentation of services that are being delivered, the commodities that is being used, the clients that are reached, and the outcomes that appear to be achieved, as well as the fact that accurate records support audits, it guides resource allocation, and that accurate records provide evidence for donors. It also prevents fraud. So you see why is record keeping essential for accountability. Apart from preventing fraud, it enables reliable reporting. And I know that in the lecture, we emphasized that weak record keeping leads to poor data. If there is a weak record keeping, it will lead to poor data, which results in poor decision and weak accountability. So that's that about the short questions. Make sure you take note of them. They are very important. And I believe that you have taken note of these questions. So these are my references. Do well to get these textbooks if you can, and you can study them the more. Once again, my name is Dr. Henry Asabwe, and we have just treated the part 2 of the topic on program planning, implementation, and evaluation. We have just done that. Today we have studied support systems for health program implementation, and we have looked at logistics, communication supervision, health information system record keeping, and we have seen some practical demonstration of data recording and reporting mechanisms. I'll see you in the part 3 in the continuation of this series. Thank you.